Hi dogs, welcome to my page. This is day 1 of 30 basics of meds in 30 days. Topic of today is management of bradycardia. So normally heart rate is around 60 to 100 beats per minute. So less than 60 beats per minute it is considered bradycardia and more than 100 beats per minute it is considered tachycardia. Now you come across a patient in casualty where the patient's heart rate is around 30 beats per minute and it is not improving. According to ACLS guidelines, we should always check airway, breathing and circulation and start monitoring other vitals of the patient such as blood pressure, SpO2, temperature and start ECG. Now just by looking at the patient, we should be able to classify the patient into stable bradycardia and unstable bradycardia. If the patient shows signs of shock, altered mental status, breathlessness, chest pain, hypotension, then the patient needs emergency care. If the patient is stable, treating the underlying cause is enough. Now, under emergency care, atropine is a drug of choice. 0.5 mg IV bolus for every 3 to 5 minutes. Heart rate comes to normal. If heart rate doesn't come to normal, then we should suspect two conditions. One is patient's past history of heart transplant surgery or complete heart block. In such conditions, atropine is ineffective. So what do we do next? In such conditions, we have two solutions: pacing methods and catecholamines. Transcutaneous pacing methods, just placing the pacing pads near the chest and start pacing if it is available. Coming to catecholamines, there are two drugs: dopamine 2 to 20 mcg per kg per minute IV infusion or adrenaline 2 to 10 mcg per kg per minute IV infusion. So my dear dogs, what are the differential diagnoses of bradycardia you know? The most important one are hypoglycemia, hypothermia, hypotension, hyperkalemia, rashes and drugs. And what are the drugs which causes bradycardia? We can always remember by the mnemonic A, B, C, D. A. Amiodarone, B. Beta blockers, C. Calcium channel blockers and D. Digoxin. Now let me know in the comment section what you mean by Cushing's reflex. So that's it for today guys. If you find this video is informative, please check out my contents. See you in the next video.